Welcome to The Explainer. Today, we're diving into that frustrating pain that can make simple things, like lifting a coffee cup or just opening a door, feel surprisingly difficult. We're talking about tennis elbow. But here's a spoiler, you definitely don't need to be a tennis player to get it. Let's jump in.
So, does this sound familiar? That sharp, nagging pain right on the outside of your elbow, maybe every time you grip something, turn a doorknob, or lift a grocery bag? If you're nodding along, you are absolutely in the right place.
All right, here's our game plan. We're going to break down exactly what's causing that pain, who gets it, and why. And then we'll lay out a really clear step-by-step roadmap to get you feeling strong and pain-free again.
Okay, first things first. What is actually happening inside your arm that's causing all this trouble?
The medical term for it is lateral epicondylitis. But let's make that simple. It's not really about inflammation like we used to think. It's more of a breakdown of the tendons from being overworked. I want you to picture a rope that's slowly starting to fray from too much strain. And here's the kicker. Despite the name tennis elbow, most people who get this have never even set foot on a tennis court.
So, if it's not just tennis players, who is getting this? And what are the real culprits behind the pain?
Well, it's most common in adults between 30 and 60. And if you look at this list, you'll see it's all about everyday life. We're talking about plumbers, carpenters, warehouse workers, even caregivers who are constantly lifting. Yeah, athletes are on the list for sure, but they're just one small piece of a much, much bigger puzzle.
And just to give you some perspective, this condition is way more common than its cousin on the inside of the elbow, which you might know as golfer's elbow. So trust me, if this is you, you are definitely not alone in this.
So why does it happen? Well, it almost always boils down to repetitive strain. Things like constant gripping, using power tools that vibrate, or maybe just going a little too hard on a weekend project. And other things can play a role too. For instance, smoking can actually slow down how well your body heals those tiny injuries in the tendon, making things worse.
Okay, so you're listening to all this, and it's starting to sound pretty familiar. So what's the next step? Let's talk about getting a proper diagnosis. And I've got some good news for you here. You probably won't need a bunch of complicated or expensive tests. For most people, a doctor can figure this out with a simple, hands-on physical exam right there in the office. It's usually that straightforward. Do these symptoms ring a bell? The classic signs are that pain right on the bony part of your outer elbow, and it gets worse when you grip something. You might also notice that your grip just feels weaker, and sometimes that achy pain can even travel down your forearm. All right, now we're at the most important part. How do you get better? And listen, it's not about finding one single magic bullet. It's a logical, step-by-step process. I want you to think of your recovery like climbing a ladder. You start right at the bottom with simple, effective lifestyle changes. And honestly, almost everyone gets better on these first couple of rungs. You only need to think about climbing higher if those first steps don't do the trick. Now, before we break down those steps, check out this quote. When we're talking about treatments that don't involve surgery, one thing stands head and shoulders above the rest, and that is physiotherapy. So what is physiotherapy really? Well, it's a personalized game plan. A good therapist will guide you through very specific exercises to strengthen your forearm, targeted stretches to get your flexibility back, and they might use some hands-on techniques. But maybe the most crucial part, they help you figure out what you're doing in your daily life that's causing the problem in the first place, so you can stop that cycle of re-injury. Now, this is a really fascinating comparison. Let's talk about steroid injections. Sure, an injection can give you some quick, short-term relief, and that can be tempting. But the research is crystal clear. Physiotherapy is what delivers the long-term solution. It has a super high success rate, and it doesn't come with the risk of actually weakening the tendon over time. But what if you've tried everything on that ladder, and the pain just won't quit? Okay, let's talk about that final rung, surgery. This is the question on everyone's mind when they're dealing with pain that just won't go away. And it's important to know that, yes, surgery is an option, but it's really reserved for very specific situations. And this right here lays out the rules perfectly. Surgery is not for when you've had pain for just a few weeks. It's only even considered after you've given a solid 6 to 12 months of real effort to things like physiotherapy, and it still hasn't worked. Or, of course, if an MRI or ultrasound shows a major tear in the tendon. And here's the reassuring part. For that small group of people who do end up needing surgery, the ones who check all these boxes, the success rates are actually very high.
It's very effective at relieving pain and getting people back to doing what they love.
Okay, let's zoom out for a second and look at the big picture. What should you really expect on your road to recovery?
If there's one single thing to take away about recovery, it's this. Be patient with yourself. Tendons heal slowly. This is not a process you measure in days. You measure it in weeks, and sometimes even months. Sticking to your plan is absolutely the key to winning this.
I want to end on this really powerful quote because it truly says it all. This is the main takeaway. For the vast majority of people, this simple combination of rest, smart changes to your activities, and good physiotherapy leads to an excellent recovery. So, as we wrap up, I'll leave you with this final thought. Think about your daily routine. How do you lift things? How's your workstation set up? What is one small, manageable change you can make starting today to take some of that strain off your elbows? Thanks for joining us on The Explainer.